This is the northern tip of Karnataka, close to the Karnataka-Maharashtra border, in the rural area of the Belgaum district, a place called Ghataprabha. Once a barren, rocky land, where trees find very little soil to take root, here stands a service organization that has quietly burnt the lamp of health and social service for last 75 years. Silent work, known to the villagers only by the service that it provides. Hospital for the poor, as they prefer to call it. But it is much more than that. Our work is not limited to just the hospital, which is a part of the institute's activities, but we also work for the upliftment of village women. Mahila Mandals are established in 25 villages of the Gokak Taluka to run balwadis, sewing classes, vocational training, dai training with local maternity centers, village health worker schemes and cultural activities. To take a glimpse at the other activities, let us take a round in the campus, which is a small self-made township in itself. This is the nursing school where 200 student nurses are staying for their education and girls from poor families are receiving free education. It is one of the best nursing schools in the country. This is the Udyog Kendra or the craft school where village girls come to learn sewing, doll making and wooden toys. This is our artificial limb center.
Arun Mangal Seva Vikas Yojana got associated with KHI in 1986 to produce Jaipur food processes for the amputees. For an Indian villager working in the farms, this rubber foot without a shoe is ideal. It lets him work in the mud or water as well as walk into a home or temple. We also fit Alimco orthoprosthetics for polio children.
We have a bakery, a cafeteria and a canteen for the patients, the workers and the guests. This is the kitchen garden producing main bulk of the fresh vegetables required in the canteen and a dairy unit producing about 100 liters of milk every day. This is our workshop where most of the repairs, fabrication and plumbing and electric works are carried out by locally trained workers. For a rural institution to live economically, it must try to be self-sufficient and self-sustaining. It should also be able to meet most of the routine needs through voluntary or in-house activities with the help of local people using locally available materials. We also run a primary school for the children of the workers and a gymnasium for the youth. A health education museum with models and charts teaches the visitors the structure of the human body in health and disease and the importance of healthy living. The influence of great pre-independence leaders like Dr. N.S. Hardikar made the institute disciplined and nationalist. All the workers gather on every last Sunday of the month for flag hoisting, and twice a year, over 600 children from the surrounding schools gather for a rally on the hospital ground. Sevadal organizations from all over the country conduct their youth and volunteers training camps here. Mukundrao Kirloskar, our president, a noted journalist and industrialist, says,
"My association with Karnataka Health Institute dates back to the year 1941. I had then come here as a patient myself. It was a small hospital with barely 20 beds, situated on a barren piece of land. There was no medical help available in the vicinity. Since then, I have seen the hospital growing from strength to strength. Today, it has a capacity of 250 beds with the most modern medical equipment available in the world. It offers medical facilities to the villagers around. The villagers come here with the confidence that they will have the most decent medical aid available at the cheapest possible price, at a price which they can easily afford. My particular admiration is because of the fact that the young Vaidya brothers who are working in the hospital have kept up the same missionary spirit with which their fathers and forefathers had worked.
The Chief Medical Officer, Dr. Kiran Vaidya, says,
The founders of Karnataka Health Institute had the aim of providing modern surgical and higher medical care to the poor people at an affordable cost and free to the deserving. And today we are proud that we have provided such services for last 75 years in addition to the primary health care in the surrounding areas. Now we are planning to add a new modern operation theatre, a 6-bed intensive care unit and an emergency room in the new annex building of our hospital, which will provide modern medical care and higher surgical care in the specialties like neurology, nephrology and cardiology. Our aim is to be the ultimate solace for the poor people in this area in their real hour of need.
this board on the exterior of the hospital building gives an assurance to the ailing patients that at whatever hour you come, we are always here to serve you. We see our God in you. For us, service to patients is service to God.